and to continue the importance of positive influences and growth and development, I'm really delighted to invite Diana Denni from the University of North Carolina, Chapel Hill, who has an inspirational career intervening in risk trajectories and focus on the future health of young people. Thank you, Denni.
So delighted to be in this conference. I'm learning so much from it personally. It's very different from anything I've attended before. I'm very excited about it. So today I will be focusing on measures used in neuroscience that help us understand the relationships between these phenomena: depression, delinquency, and drug use was the title I was given, and what the neuroscience tells us about how to structure our environment to prevent these problems and nurture healthy child and adolescent brain and overall development. So depression, substance use disorder, SUD, and delinquency are not distinctive problems. Their relationship is strong and it's not coincidental. They emanate from similar root causes. They each tend to develop or worsen during adolescence, having much to do with puberty and newfound autonomy and social demands during this period. And when one occurs, it's very likely another one will surface. On the other hand, the research is inconsistent, so it remains unclear as to whether depression or SUD, substance use disorder, leads to delinquency, or whether delinquency leads to depression or substance use disorder, or whether there's bidirectionality, which I show here, that we really have not yet established clearly. Now, in terms of these relationships, we know that depression is moderately related to conduct disorder. I refer to conduct disorder, which is a behavioral reality and not a legal abstraction, as is delinquency. And so you see here in the yellow at the top that it is moderately related to child and adolescent development. Substance use and depression is much more related. About 1 in 3 individuals with major depressive disorder engage in substance abuse. And here we show that there's a very high rate of SUD and juvenile justice involved kiddos, and that a high rate of conduct disorder in many studies showing as much as 90% is present in both substance using and non-substance using juvenile offenders. And also there's a much higher percentage of substance abusers versus non-substance abusers that demonstrate comorbid psychiatric disorders, more than one. And then here we show the link between mental health and substance abuse overall, internalizing behaviors or disorders that include depression and anxiety. Externalizing disorders are, include conduct disorder and antisocial personality disorder, the outward manifestation of aggressive behavior and that sort of thing. And externalizing disorders are more associated with both drug abuse than internalizing symptoms, but still the link is strong for both. So even though depression and conduct disorder are very different symptomatically and behaviorally, the brain mechanisms that lead to substance use disorder, which is an externalizing problem, appear to be similar and are uniquely at play during adolescence, when the brain's frontal lobes haven't completely connected with lower emotional centers. And so we show here that adolescents, and this is key, adolescents with less connectivity between these prefrontal areas involved in goal-directed attention, inhibition, working memory, etc., with lower centers, are more likely to develop depression, conduct disorder, and misuse of substances. So the brain is being remodeled in adolescence, and it tells us a lot about what's going on and what people may be prone to during adolescence. There are two very important changes taking place involving the prefrontal cortex, the front of the brain, shown here in orange. The patterns of activation within this area generally become more focused, more efficient, more effective. But also the activity here becomes increasingly coordinated with other parts of the brain, especially the limbic system, which modulates emotion. So the brain's dependence the brain's development is experience dependent, and it does not stop in childhood. And in fact, from a neurobiological standpoint, adolescence doesn't end until late 20s. And that's when we begin to see cognitive control, the executive cognitive control over emotional responses. But as I'm always telling my kids, it doesn't end until the late 20s, when you're fully mature from a neurobiological perspective. And all of these changes do not occur in a vacuum. The brain is plastic and experience dependent, for better or for worse. For better, it gives us opportunities for intervention that might be very effective throughout adolescence in its late 20s. But for the worse, it means that adverse childhood experiences affect the brain's development very directly. And here we have, an example of that for household experiences, community, and environment, all affect child development. And as a mediating factor in explaining how depression, delinquency, and drug use all may occur. And this shows at worst, in addition to just adversity, but trauma predicts early onset escalation of substance abuse, relapse, and treatment resistance. And trauma affects these reward circuitries in the brain. And so interestingly and importantly here is that these are the same brain regions that are implicated in psychopathology, including depression and conduct disorder. So the interrelationship is quite clear. So what about the promise of prevention science to address this? We want to do two things in prevention. We want to mitigate the negative effects of adverse social determinants of health and well-being on children, families, and communities. But to me, that's the second line of defense. The first line of defense is to reduce exposure to the aggravating conditions in the first place, and to promote positive and protective conditions that are conducive to normative development, mental and physical health, and well-being. And I realize I'm at time. So I'm going to, before you can tell me that, Susan, I have my little timer up. And just to say that good preventive interventions work to strengthen those cognitive controls over emotion, and that mindfulness programs have been shown unequivocally, indisputably, to have that effect on the brain, which is why that I always promoting them as my little model of how it might work. And then finally, just to say that findings from neuroscience have the ability to help us integrate basic science into a holistic model of intervention, policy, and practice. And I will end there.